To reduce the risk of suicide, the Joint Commission requires screening all patients for suicidal ideation who are being evaluated or treated for behavioral health conditions using a validated, evidence-based screening tool. This presentation will show you where to find the Columbia Suicide Severity Risk Scale in Cerner and how to complete it. The Joint Commission requires the use of an evidence-based process to conduct a suicide assessment of patients who have screened positive for suicidal ideation. The assessment directly asks about suicidal ideation, plan, intent, suicidal or self-harm behaviors, risk factors, and protective factors. This is covered using the SSRS if completed in its entirety. Did you know in 2020, 45,979 people died from suicide in the United States. 3.2 million adults had a plan, and 1.2 million adults attempted suicide. How does Wyoming compare? As you can see, with a suicide rate of 29.4 per 100,000 people in 2019, Wyoming ranks first in the United States for suicide deaths and doubles the national average of 14.5 deaths per 100,000 people. This statistic is the primary reason why we must ask the difficult questions. Anyone can identify someone at risk for suicide. Listening attentively and asking the right questions may save someone's life. As you can see on this slide, the deaths due to intentional self-harm increased from 29.4 in 2019 to 32 in 2020. At Memorial Hospital, we screen all patients for suicide risk in the emergency department, medical surgical department, ICU, obstetrics, and now outpatient clinics. A reassessment using the SSRS must be completed daily on patients that are admitted for suicidal ideation. It can also be used as needed for any changes observed in your patient's demeanor. The next few slides will show you where you can find the SSRS screener based on your work location. In the emergency department, the quick screener is located on the ED Adult Systems Assessment Band. This is only the quick screener if your patient screens high or moderate risk for suicide. The full version of the SSRS must be completed from ad hoc. In med-surg or ICU, the screener is in the admission history and also in ad hoc. This is what the screener looks like for the OB department. In the full version of the SSRS in Cerner, click on ad hoc from your toolbar and choose one of these options. For adults, choose the full version adult. For children, use the full version child. This screener is used in the ER as a quick screen, but it doesn't contain all of the information needed if the patient screens moderate or high risk. If your patient scores high or moderate on this quick screener, you must open the full version and document all required information. The Joint Commission requires a suicide assessment of patients who have screened positive for suicidal ideation. The assessment asks about suicidal ideation, plan, intent, suicidal or self-harm behaviors, risk factors, and protective factors. The full version of the SSRS addresses these elements. After retrieving the full version of the SSRS from ad hoc, start with the first band seen here. This is similar to the screener used in the ED. Answer the questions and move on to the second band, which is intensity of ideation. In the third band, you will address suicidal behavior. In band number 4, this will address the actual or potential lethality of their situation. For this assessment, you will obtain more information about your patient and what events led them to this point, any past treatment history, and their clinical status. Don't forget to scroll down on this page for more information. The overall risk level must be documented. This is also where you can find additional information like your action plan. This is a great place to document that your patient is being one-to-one monitored and other protective factors you initiated to mitigate the risk of suicide. This is Memorial Hospital's policy for actions required based on risk level. As you can see, if your patient scores high on the risk scale, you must stay with the patient until he or she is placed in the safest room possible. Notify provider, immediate one-to-one monitoring, and contact Southwest Counseling for an evaluation. One-to-one monitoring start time must also be documented in the patient's chart. Here is a list of available local resources. A copy can be obtained from Robin Fife in administration. Here is another list of additional resources, including the counseling agencies locally.